I had no barriers to accessing information in this extensive review and its sometimes investigation of issues, and I'm so grateful for that. And I particularly want to thank the many Indigenous organizations, peoples, and leaders who have participated, and thank the First Nations Health Authority for providing therapeutic support through the line and the number for people who have been triggered and have had mental health trauma by this report, and the Métis Nation of BC who have likewise done so. So I believe that Indigenous peoples will have their voices heard and amplified today, and I think that's important for today. And I think I hope very much that this will be more than just one day today, that this will begin a process of significant change in British Columbia that can mean at the point of care, cultural safety, respect, and the elimination of all forms of discrimination against Indigenous people will be realized. Thank you.
Thank you very much, Dr. Turpel-Lafond, Mary Ellen, for this extraordinary work. I think this report, the fact that it was done so expeditiously, given its substance and the extraordinary response from people, will have an enormous impact in BC, I believe across Canada and elsewhere, as we deal collectively with these very difficult issues. The report in plain sight shows racism at an individual and systemic level. Racism that has made the BC's healthcare system an unsafe place for many Indigenous people to access services and the care they need. Racism affects health outcomes, a fact that is clear in the testimony and detailed statistical evidence in the report. On page 35, for example, you'll find an Indigenous doctor's account of how they had refused to go seek treatment at hospital as a patient because they feared the racist and discriminatory treatment they'd receive. Or on page 29, Indigenous women left a specialty hospital against medical advice at a rate 11 times higher than other residents. Or the report's survey of responses, thousands of responses, which concludes amongst the survey participants that 84% of an Indigenous patients experience racism in the healthcare system, and 52% of Indigenous healthcare practitioners face racial prejudice. Racism is toxic for people, and it's toxic for care. I want to make an unequivocal apology as the Minister of Health to those who have experienced racism in accessing healthcare services in British Columbia now and in the past. I want to sincerely thank all those who participated for reaching out to tell us of your experiences. Hospitals and clinics must be places of trust and comfort, and all of us should have confidence that without a doubt we will receive the respectful care that we all deserve. My apology today is an acknowledgement of the pain that Indigenous people have borne from racism. It is a first step, however. I will recommend to the Premier to sit down immediately to work out our government's response to meet the report's first recommendation and set us on a path to healing and reconciliation. This will be planned alongside First Nations and Métis partners. When I learned of allegations that there was a game being played in an emergency room to guess the blood alcohol level of patients, we set out to find and follow the facts of the investigation. And Dr. Turpel-Lafond and her team did just that. The facts of Dr. Turpel-Lafond's investigation did not lead us to evidence of a game occurring in BC's hospitals as originally depicted. It did lead us to the certainty that stereotyping, racism, and discrimination exists in our BC healthcare system. Systemic racism exists, it persists in our healthcare system, and it is damaging to the health and wellness of Indigenous people in our province, and in fact, I'd argue, to all people in our province. I want to say to you today that I'm 100% committed to making sure the healthcare system here in BC is providing safe, high-quality, accessible, and culturally safe care for all peoples in BC. And it is my determination that racism will have no place here. I'm committed to working hard on all of the changes outlined in this report, and I'm committed to doing that in partnership with Indigenous health and community leaders. I want to ensure that the structural and systemic changes that are recommended make a real and meaningful difference for any Indigenous individual who needs and seeks health services. As Dr. Turpel-Lafond said, the point of care is essential here. The Ministry of Health will work very closely with our First Nations health governance partners and Métis leadership to make positive change. As immediate steps, 5 new Indigenous health liaison positions are being added in each health authority, and I have directed the ministry to review medical staff bylaws to implement consistent standards for cultural safety and humility as an expectation for medical staff privileges. It is important to emphasize, as in the report, that these recommendations build on the work, the commitments, and efforts of staff across the healthcare system to improve care for Indigenous people. But we all need to recognize and recommit to eradicating racism from our health system, to ensure that our beliefs and behaviors are anti-racist and based in cultural humility. The release of this report is not to blame or shame the people who have chosen a field of service in healthcare, but it is a call for us to actively do more as individuals and as a system. The situation as it exists and as is depicted in the details of this report cannot stand. This report does give us, the provincial health system, the opportunity to accelerate a comprehensive approach to address long-standing challenges of racism and the legacy of colonialism, rooted in principles of human rights. The advancement of these recommendations shall be grounded in the Declaration on the Rights of Indigenous Peoples Act. I will be directing the Ministry of Health to fully engage in working on all recommendations in the report with our Indigenous governance partners. At the core of our response will be action. Action to implement the recommendations. Action to ensure that Indigenous leaders are fully included in any response. Action to see that change happens. I'm pleased to announce that Don Thomas, currently the Vice President of Indigenous Health and Diversity, Equity and Inclusion at the Vancouver Island Health Authority, will be seconded as Acting Associate Deputy Minister to lead this work. Over the coming days, we will be reaching out to leaders who bring First Nations, Métis, Indigenous, and health system perspective to form a task force to support Don Thomas and implement the urgent change that is required, consistent with the recommendations in the report. The task force will be accountable for regular reporting on the progress, updates, and advancement as we move to implement a comprehensive system-wide approach to these recommendations. I have also asked that both the 1-800 number and email address that have been used throughout the review to bring forward instances of racist behavior be continued in the coming months until we get action firmly underway on an effective complaints process. Dr. Turpel-Lafond has agreed to stay engaged to support my Deputy Minister Stephen Brown and the new Associate Deputy role to advance this work. I am, again, very grateful to Dr. Turpel-Lafond and her entire team, and especially, and most especially, to every person who shared their stories, so often private and painful, to recount and retell. I thank you all for your courage and commitment to help all of us make real, meaningful change. I look forward to working with Indigenous leadership, health professionals, colleagues, and partners to further advance these recommendations. As the Minister of Health, I want to direct the change that will give people in BC the confidence that when they arrive at the doors of our healthcare system, they will be seen as they are without bias and prejudice, and with care and respect. To address systemic racism in our healthcare system and root out its deeply damaging effects, every single one of us must ensure the necessary changes to our behaviors and beliefs. Only then can we find lasting and meaningful equity and reconciliation. Today, the vision for change may be mine to share, to maybe Dr. Turpel-Lafond's to share, but the strength is for all of us to make it grow. And the reality is it is for all of us. It is ours to make. Thank you very much. I want to welcome your questions. I want to welcome Dr. Turpel-Lafond back to the microphone.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question is from Rob Buffum, CTV Vancouver Island.
Oh, hi, good morning. Thank you for taking my question. I guess my first question is, you've said in the report and today as well that you did not find widespread evidence of the alleged blood alcohol game, it was being called. But I'm wondering, there was reports this summer that specifically Sandwich Peninsula Hospital was one location where that was taking place, targeting Indigenous people. Can you comment on whether that is the case?
Right. I think it's important for me to note that I didn't find an organized Price is Right game. I did find that there were activities happening in places and during certain episodes and times where there were what I would consider to be guessing games or treatment that would not be consistent with what we are suggesting is required for quality. And in those different places, there has been some work underway over the last number of months. I think in particular, I'm not here to give you an assessment of the quality hospital by hospital. Certainly you're going to see when I release the data report the kind of information that's there. I do think, though, that hospital as one hospital is a place where there's been significant work underway over the last number of months. And I certainly do check in with the First Nations leadership local to the Saanich Peninsula Hospital, and they tell me that there has been some significant change in terms of the quality of service and the relationship building. So that's one of the, I guess, unintended but important consequences of this review. So I can't go into a lot of detail hospital by hospital. I did a confidential review and received information on a confidential basis, but I can say that there are a number of places in British Columbia where there have been active processes underway for the last 4 months to bring forward issues, discuss them, and attempt to do a reset. And I think that's a very positive development.
Do you have a follow-up, Rob?
I do. I'm wondering about in the report, as I understand it, 13% of healthcare workers in the survey had made racist comments. I'm wondering if you're able to kind of expand on that a little bit, as well as it's my understanding that people, although the report focused on Indigenous and Métis people, there was other people of color who were also interviewed for the report. I'm wondering if you can comment on if there was any findings relating to people who were, the subject of racism who are not Indigenous or Métis.
Yes, I think one of the difficult things that we found was even when we were engaging those more than 5,000 healthcare workers and surveying, they identified perhaps an encounter of discrimination at the point of care that they had seen or heard. Yet for 500, they also repeated what I would call to be an implicit prejudice against Indigenous people, and more than implicit, explicit. So they may have identified very well and accurately when abusive engagement happened with stereotype behavior, with personal racism directed at a patient. Yet in the survey, they would also have said, they should get over it. They should stop being victims. It's their fault. So there was a lot of comments, more than 500 comments. And throughout the process of the review, I received a lot of racism, emails to the team, descriptions that took very, instead of saying all lives matter, stop looking at anybody. So really discounting the importance of addressing the treatment of Indigenous people. And at times, I did receive issues or allegations that affect peoples other than Indigenous peoples. So Black, people of color in British Columbia. I was only looking at Indigenous specific racism. But however, there were many comments that suggest to me that there are still attitudes and opinions that are circulating in health professions that even though they may be able to identify an abusive interaction that involves a stereotype and poor treatment, they repeated many of those key stereotypes as well. And that was a concern to me. And that tells me that we need more work to be done. And that in terms of privilege, all healthcare workers are working very hard at this time, but some of those attitudes and opinions repeat the kind of prejudice that results in poor treatment in their workplaces and at the point of care. So that has to be addressed. I was surprised it was as extensive as it is, but it gives me greater resolve in the recommendations, in particular where I talk about speak up culture and rooting this out and dealing with it. It gives us a better understanding of what it is. What are the opinions that are circulating that are racist and prejudicial that we need to bring forward? And to some extent, it does mirror other things I've seen, like in particular when issues of residential school were first being brought out in Canada and in British Columbia. There was a strong backlash of just get over it. We're not going to talk about that anymore. We don't want to deal with it. Too bad. That's in the past. Not understanding the continuing impacts that these behaviors and thoughts have and the barrier that they create to culturally safe service and communication. So I just noted it. And I would say that it was a bit shocking that it was that high in British Columbia. I particularly am concerned about Indigenous people who work in the healthcare system, who have experienced direct personal racism. It's important that they're safe today. And I certainly wouldn't want anyone in the healthcare system to say, hey, did you see that report? Let's start talking about it with you right away. Because how to talk about these things, how to engage respectfully, we need to make sure First Nations and Métis healthcare workers in the system are safe and that we deliver services to patients, but we also have a collegial environment that is respectful. And some of the Indigenous nurses and staff in the system and doctors even have themselves experienced racism. And some of it has been career-limiting racism. And that's something that needs to be acknowledged and needs to be worked on. So the kind of 500-plus comments based on intolerance and racism, that was concerning. And if I was in that workplace today, seeing that and feeling that, I could see how it would affect things. So we do need to make those changes. Thank you.
Next question is from Richard Zussman, Global News.
And Mary Ellen, are you satisfied with the response that we just heard from Minister Dix and from the province? And are you satisfied with the timelines that they're working on?
Yes, I'm very pleased. As I said, I'm just very grateful that Minister Dix commissioned sort of like the first ever complete review of racism against Indigenous people in a healthcare system. This was an enormous sort of undertaking. I'm glad to have been able to provide this back to him. I'm also very grateful in my conversations with him and his senior officials that, and what I heard today was that there's a commitment to not only accept the report, but to work what are the near-term measures today. And in fact, I was very pleased to just hear Minister Dix give a very bold apology. And I do feel that he has to set the tone, and I'm grateful that he has set the tone. I do think that there needs to be apology. There needs to be engagement with Indigenous people at the point of care. And when you have a hospital in a local First Nation or Métis community, I'd like to see very local engagement to be able to begin to root that out. But I'm very grateful that he has set the tone. And I'm also very grateful that he said he will bring it back to his colleagues in the government of British Columbia at that level. Because for sure, addressing the racism we've seen here is about the health system doing its part, but it touches on other systems. And I did have a chance on the weekend to speak to the new Minister of Education and send a letter to the Minister of Education, because cases did come forward during this review that touch upon how Indigenous people are treated in the K-12 system when they get healthcare services there. So I'm grateful for the fact that he will bring the issue for a broader discussion, and he has indicated some strong leadership. And of course, am committed to support him and support his ministry. And I've worked closely over these last 4 months with all the health colleges, the health authorities and others, and had some, I would say, difficult conversations at times. And conversations about addressing racism. And I think we're all in a very good place today. But I know Minister Dix has carriage of the system of healthcare, but there's a lot of partners. And for his part, I'm really grateful for the apology. It's up to Indigenous people whether they can accept that apology today. And no one is here to say to people how apologies should be taken, but apology has a very powerful thing because it acknowledges something and it begins a process. And I think that the beginning of this process is much more positive than it could have been. And no doubt there are other places in Canada where there's not the kind of understanding and acceptance that we have in British Columbia, which makes me feel encouraged about our ability to work together and address this in the next matter of sort of days and months.
Richard, do you have a follow-up?
Considering, Mary Ellen, how deep-rooted this racism is based on your findings in the report, it's clearly not a simple fix. Is there optimism that things can be fixed, considering there will be people, working in the workplace that have been doing things a certain way for a long time? Is training enough to address that? I know this is a big question, but, how do we break down those long-standing barriers that have existed?
Right. Well, I think I think there are mechanisms to do that, like just very basic things like defining quality of care as meaning having the experience of care. Quality itself means not having racism and discrimination. And so we have our Patient Quality Care Act. It doesn't have a definition of quality that includes that. That's something that could be changed quite quickly. And that activates a very clear understanding that what we see as quality in healthcare means you are free of all forms of discrimination. And if you have a concern about it, you can go to the patient quality process and be heard. Obviously, it's important that when people are treated with discrimination or racism, that they also have a real remedy and a way to bring it forward. We need to strengthen that, but we need to define quality in a way to say very clearly that it includes having healthcare services being delivered free from all forms of racism and discrimination against Indigenous people. So yes, there are issues in society without a doubt, but in healthcare, it's very significant. And as I've said in this report, it isn't just about negative personal interactions. Literally, the report includes multiple comments that I heard of people saying, I would rather die and not get the needed healthcare treatment than go back into that system and get it. And that is a very significant problem. We need to change that. So not only is there quality, but it's a safe environment and it's a welcoming environment. And certainly my message today to Indigenous people is if you think you need healthcare, please get it. If you're concerned about how you're treated, Minister has allowed us to continue our 1-800 number in our email line. We want you to speak up and speak out. We want everyone in the system to speak up and speak out. And we want non-Indigenous people to be informed about what the kind of racism is that's operating in the healthcare system. What are the stereotypes? And we can start to dismantle those. So I do feel very encouraged. I know it is deeply rooted, but we have to begin somewhere. And today is the beginning. And I think that we will need to measure where we get. But today is a very important beginning. And so I do feel encouraged by that.
Justine Hunter, Globe and Mail.
This, and I'm wondering how you go about doing this. How will you be able to determine that this is actually making the changes that you're calling for here?
Well, there's a number of things you can do, and I was fortunate in my team to have people like Dr. Perry Kendall. So the survey instrument we designed, it has a longitudinal. We could run it again and see how we're doing in a period of time. Are we seeing less of those abusive interactions? And so I think the 24 recommendations, some of them really are to get at how do you change system, how do you root out racism, how do you ensure that the goodwill that's being expressed, at least to me, to address it can be marshaled into on-the-ground change. So I feel very strongly that there are specific details, and again, I'm not going to go through all of the recommendations. A lot of them have to do with today, acknowledging, validating, and encouraging a speak-up culture. Going forward, it is going to require some hard work in the healthcare system. As I said, applying the Public Interest Disclosure Act to the healthcare sector is something that I think is very important and can be done quite quickly. So we can begin to get that out and go forward. So I feel that prejudicial attitudes are attitudes that can be dismantled. Some of it is implicit bias. It might be more explicit. There are some clear and intentional racism that is functioning in the healthcare system. But I think we need to begin that process of taking it apart, identifying it, and being so clear that it is not an effective strategy. It has no place in the healthcare system, but it doesn't actually serve the needs at the point of care of supporting and doing the work that has to be done. It doesn't belong in the healthcare system.
Do you have a follow-up, Justine?
Minister Dix, I'm wondering if you can specifically respond to the finding that 13% of the healthcare workers who filled in the survey themselves made racist remarks in that. Where do you begin to deal with that?
I think you do that by starting the work. I'm very honored that Don Thomas, who has done extraordinary work, Dr. Turpel-Lafond referred to the situation at Saanich Peninsula Hospital. A lot of the change has been inspired by the work of Don Thomas as Vice President of Vancouver Island Health Authority. She hasn't been in that position a long time, but she's now taking on this challenge on our behalf, and we have to simply start that process. So some of it involves changes to systems, and you'll see those recommended in this report. And some of it involves ongoing work with individuals. I think that the existing education and other efforts we have in place, many of them have done well, but they're not sufficiently taken up or sufficiently in place to make the change that we need at a point of care level. I think it's really important to have effective complaints processes, and the kinds of recommendations around complaints processes in the report by someone who I think is an expert in giving the public voice in system decisions. As the child representative, Dr. Turpel-Lafond is exceptional in that regard. But I think it's really important as well that every day people have confidence that they can come in and get care. And I want to say to people that it's all of our responsibility to make sure people have that confidence. And that really is the key moment in this report. How people will feel about getting care, how we can address things like people leaving hospitals because they want to get away from care, even when it's recommended that they stay and get care. Those are fundamental, so we have to focus on that. And I profoundly believe change is possible in these times. So yes, there are people who harbor beliefs, and I also believe, though, that the people who go into care fundamentally believe in care and believe in helping others, and that's a pretty strong basis to develop change as well. So we have to acknowledge the situation exists. That's what we're doing today. We've done that in the past, and we've had some success in the past, but now we have to do something far broader and more systemic, because we've asked for this review. The review has shown facts such as the one you've laid out, Justine, and we have to act on that. And is it going to be easy? Of course it's not going to be easy, but the way to do that is to start. And we've been doing that over a number of months, preparing some initiatives, but now we have to make sure those initiatives both meet the test of Indigenous partners, and that's an important part of consultation. But we have we're putting the task force in place and the people in place to make change happen, not great statements about accepting all the recommendations, but action today. Dr. Turpel-Lafond will be part of that action. Our whole team will be part of that action. It'll be led by an outstanding British Columbian, Don Thomas, and I think we're going to have some success. We're going to solve every problem by tomorrow or by next week or maybe even by next year. But the way to start to address these things is to give yourself tests and then to set a standard for success, and then start to work to do that. And I think that'll make a big difference. And the person I want it to make a difference for most is the person who needs health care in BC and is reluctant to get it now. That's the test that we have to set for ourselves. That's the most important test, and that's the test that I'm setting for myself as Minister of Health and the entire healthcare system.